Another avenue of therapy could be surgical. If the soft palate is large and hanging low down into the airway, perhaps trimming that soft palate off could relieve this to the point where this problem will go away. Unfortunately, often the surgical success that we enjoy in the early stages is due to the scarring. And as the human heals, the scar softens and sometimes the problem returns. If the problem is rooted primarily in craniofacial abnormalities, perhaps a surgical intervention to reposition the lower jaw further forward, that may produce a cure for the problem. I believe fundamentally that we should always exhaust the non-invasive, reversible opportunities first before we take surgical adventures. To that then we can turn to what has been the gold standard of treatment for obstructive sleep apnea. It is a ventilator-like device known as continuous positive air pressure. It has been the gold standard of treatment for many years. The problems with use of continuous positive air pressure is that it is very difficult to accommodate. Compliance is often not where it needs to be in order to protect the life of these patients, and the reason has to do with what one has to wear in order to effect the passage of air, in order to create a column of air behind the tongue that will keep the airway open. This is a life-saving device known as CPAP, for continuous positive air pressure. And how this works is that we use a ventilator type of machine that pumps air. It's ordinary room air. It may be humidified for certain circumstances in different parts of the world, and the air passes through the hose into a mask, and there are very many differing kinds of masks. This is just one example, where it captures the nose, pumps the air through the nose into the lung cavity, and therefore establishes a column of air that supports the tongue so the tongue does not fall back into the airway. And this, as I opened this segment as a life-saving device, is exactly what this is. These devices save the lives of people who have severe obstructive sleep apnea. And there is no question in my mind that this is where I would go, where I severe. They're not easy to accommodate. There is a little bit of difficulty in putting them on and wearing them and dealing with the hoses. But let us not lose sight of the fact that if you are a severe apneic and your life is in danger every time you shut your eyes, this is the way out. Another alternative therapy in treatment of these conditions is what we refer to as oral appliance therapy. We have agreed that it is the collapse of the lower jaw as one of the major causes of this condition. And naturally, the smallness of the airway is a part of it. But as that jaw falls and blocks the airway by pushing the tongue into the airway, what if we could stabilize that jaw so this can't fall? At the same time, if we could move that jaw forward into a more anterior position, would we in fact tend to pull the tongue out of the airway? And the answer is yes. And how we do that is with a device that's made a two-component device that looks very much like an athletic mouthguard, but just is a very great deal more complicated. But if that were your sleeping position, what if we were to take that jaw forward and secure it like that? Would that not hold the tongue out of the airway? Would that not prevent the jaw from collapsing during sleep? And the answer is yes. There are many, many types of oral appliances that we have as options. The option that I use in my practice is an invention of myself. We call it the silencer. And what we choose to do with this appliance is look for the sweet spot. Successful therapy is a marriage between comfort and function. If we do not have comfort, we will not have function. That applies to either CPAP therapy or oral appliance therapy. So what we must have is an appliance that will deliver both of those. To do that, it must allow the lower jaw to move while it's held in one place. And with that, we also then find that sweet spot, but allow the jaw to move. And what we use in our appliance is a device that has a titanium hinge placed into the appliance that allows the lower jaw to move, so there's mobility, and it also allows the clinician to find that sweet spot by adjustments that can occur. And those are either front to back adjustments, or they could be vertical adjustments. But once I make the clinical decision that this is the starting point, then I use these adjustments to work around the adjustment position that we require. So in summary, the two most commonly used therapies for these conditions are the continuous positive air pressure, that we fit the mask, attach the pump, and we solve the problem that way, or we do jaw positional therapy by using an appliance. I have already confessed that I am one of us. I have been a major snorer all of my life. It wasn't until I was in my mid-50s, however, that I began to understand that there were other things going on. I kept hitting things with my car. And in 1989, I hit a freeway abutment at 60 miles an hour sound asleep, which was more than a wake-up call for me. That led me to seek therapy. I was not able to be comfortable with anything that I was offered, and I chose to come up with the silencer appliance, which I have demonstrated that I wear every night and have done so for 15 years. I've also had the privilege to treat a large number of patients over those 15 years. The most poignant story that I can offer you is one of what became a friend of mine. He was the Guinness World Record holder for snoring, and I'd like you to hear some of his story.